We're gonna be before cardio, so they'll already be in the seated position. Then we are going to auscultate the carotids. Again, we listen before we palpate to make sure we don't dislodge any plaques. And then I'll have you turn that way for me. Yep. And so again, you're listening with the diaphragm. And then you're going to palpate. So you can see it's usually right here, right in front of, say where this SCM is, so right there. And then you'll do the same on the other side. Pads of your fingers, and then the verbiage is
no carotid breeze, carotid pulses.
And we can just call everything 2+.
2+.
Carotid. Yep. All right. So then you're going to put the head of the bed at 30 degrees, right about there. Going to have your patient lay down. Okay. And so we do the tangential lighting. And you have to do that with your lights on this side. So you come to this side to look and do the inspection, but anytime you're listening, you're going to be on the right side of the patient. So, okay. And you're going to be looking. Sometimes just kind of getting down at the level. For old, so they don't like to stay up. It should be right about here. You can do this when you're practicing. Really for the exam, you're just gonna come over, you're putting it this way, you're looking, and then turn off the light, you're done.
No lifts or heaves, PMI is not displaced.
And then we are going to palpate the valvular areas. So this, we're just going to do the 4 valvular areas. So for this, coming down, right? So here's his clavicle. The angle of Louis is right there at the manubrium. You should feel that notch. So here, here, so right here. All right, so midline, right about mid-clavicular line. And you're just gonna put your hands over here. And then same thing on this side, so you can move because you already found your second intercostal space. Moving over, and then palpating, then moving down, so tricuspid region, and then over. So it should be here, we're at second, so we're already there. We're coming down to the 4th or 5th here, and then just moving laterally here. And you're just palpating. Really, it's just to feel. You kind of have to put it on there for a minute because we want to feel if there's any vibrations. Feel if there's any vibrations. Feel and feel.
No vibrations or thrills.
Okay. And then we are going to listen. So it is diaphragm first.
Yes.
Yes.
Okay. So those same exact areas. And anytime you take it off, we do want to see you find that placement again. So just feeling here, here, here. So listening. Does that have you say verbiage?
Verbalize areas as you proceed.
Okay. Say aortic, then moving over, pulmonic, and then remember herbs, you're just gonna drop down 1 to the 3rd intercostal space. So herbs point, then 4th, 5th, so the tricuspid, and then bringing it laterally for the mitral. Okay. And then, so that was all the diaphragm.
No, it's the bell.
Okay. Does it have you say verbiage?
No, it just
there?
says verbalize areas as you
Okay.
proceed.
All right, so now listening with the bell portion. Again, finding your landmarks again. Okay, so aortic, pulmonic, herbs, tricuspid, and then mitral.
So there's 5 areas?
So that herbs point. So there's 4 valvular. So you're gonna palpate the 4 valvular, but there's 5 places that you
Okay.
listen, and that's that herbs point is that extra one at the 3rd intercostal space. So then, if you are talented enough and you can stay in this position, I've had people that can do this with one hand. I can't, or I'll just drop him. So you're going to lower, and then you can, if you want to do it after you lower, finding your placement, and then so tricuspid, mitral, and then I'll have you lay in the left lateral decubitus position, so putting that over your hand, and you can just kind of roll with the patient and listen. And then the verbiage there.
I'm listening for S3 and S4 with bell.
Yeah. All right, and then from there, you're gonna have them sit up. And this is when I do the
Also take for S2 split.
Yep. So that 3rd intercostal space, what you're gonna have them do is take a big deep breath. So you'll find it, put the stethoscope, take a big deep breath, and then have them lean forward and blow it out. Okay?
Listening for S2 with inspiration.
Yeah,
No
so you'll
murmur.
say listening to S2 split with inspiration, and then the verbiage for when they lean forward is going to be no murmur of aortic regurgitation. So have them doing. So finding again. So clavicle. So here. All right, so take a big deep breath in.
So this
So
is I'm
listening
listening.
to S2 split with inspiration, and then exhale, and then no murmurs of aortic regurgitation. Okay, then we're gonna move on to the
Quality.
all of the queries. So at that point, because there's no there is nothing you do, you just say, let me see, that is great. Rate and rhythm are regular without murmurs, gallops, or rubs. A lot of times people will put a time check there because it's always, we're linking the verbiage to the action. And once you do listen for the aortic regurgitation, there's no action after that. So to kind of key you in on like, hey, I'm done with that portion, I need to say something, they'll have us say like the time hack, because that's a good place anyways. And then they'll be like, okay, rate and rhythm are regular without murmurs, gallops, or ups. Or you can just associate it with laying the bed down. So, or having them lay down. So it's like, okay, when I'm going to pull this out, then I need to make sure I say the regular rate and rhythm. But however you can memorize it is there. So then we are going to listen for the bruits. With this, make sure that you're listening with the bell. So I'm going to listen for the bruits with the bell. So here for landmarks, again, you want to find the xiphoid process. So his xiphoid process is right here. And then the umbilicus could kind of go here to here, halfway. There's going to be, so you're listening to the aorta. And then, does it have it?
Aortic, renal, or iliac.
Does it have you verbalize?
Just at the end.
Okay. So yeah. So going here, here, right in the middle. So listening the aorta. And then you're gonna go just to the side of it for your renal. And just to the side, the renal. Then here, so umbilicus to his ASIS right there. And then umbilicus to ASIS right here. Okay, and then for the femoral, what you will do is...
This one's just aorta, renal,
Oh
and
yeah,
iliac.
that's right.
So no aortic,
As
renal,
we go
or
into that.
iliac artery bruits.
All right. And then we go into the palpation.
Lymph nodes.
Okay. And that is why, yeah, because you will go into the femoral, looking for inguinal lymphadenopathy. So from there, then we'll do, and I am just going to do it over. So it's going to be, you're going to have your patient kind of pull it down right there to the top of the ASIS, and you'll put on gloves because you're going to palpate for the inguinal lymphadenopathy. So as you're palpating for the inguinal lymphadenopathy, what you want to do is also you're going to feel for the femoral pulse. So when you feel the femoral pulse, then you're going to do, we call it hot swap essentially. So you'll have the, we just do the, with the bell. Yeah, so still with the bell. You'll palpate for inguinal lymphadenopathy, palpate for the femoral pulse, and then switch it out and then listening.
And this is under the pants.
But
Okay.
it's going to be under.
So no inguinal lymphadenopathy, femoral pulses are grade 2+, no femoral bruits bilaterally.
Yep, perfect.
Just do that on both sides.
Yep, do that on both sides. And again, it's kind of finding, you should be able to feel kind of where the hip bone is, following that crease down, and just palpating for the inguinal lymphadenopathy, and palpating pulse, and then kind of doing hot swap, and feel or listening with the bell for any bruits. Okay, then we go on to our pulses. So we will do brachial first. Okay, so there's bicep and tricep. So right here, you want to make sure that you're doing them back and forth, right? Because we're kind of comparing. So palpating for the brachial pulse, because you're also going to be doing it, giving them each grades. So here, palpating for the brachial pulse.
And it is okay if you reach over them?
It is
Okay.
for time's sake. For the radial, if you like want them to have their hand, that's fine. So you don't have to like reach so far. But for brachial, really you're just gonna have to lean, and that's okay. So brachial, radial. So feeling for radial pulse here, and then let me see that arm. Just feeling radial pulse. Okay, and then
Ulnar.
do we do ulnar?
Mhm.
That's right. Ulnar. Right here. So you'll feel the ulnar bone. You should feel the ulnar bone and then come just medial. So ulnar. Okay, and then we do
Popliteal.
popliteal. So for this, you're gonna go ahead and have them bring their legs up. Bring the legs up. And they will stay with their knees flexed because after this exam, we're going to be doing abdominal exam, and their knees have to be flexed whenever they're when you're performing the abdominal exam. So when you bring them up here to do the popliteal pulse here, popliteal pulse here, and then the posterior tibialis. So medial malleolus, you're gonna go kind of inferior and posterior. So you should be able to feel it right here. You can actually, for those, compare, because you can feel really good. And then to do the dorsalis pedis, I'm gonna have you flex your toes up. So yep, and you're going to kind of track that. It's just easier to feel. And his, yep, so pretty much right here between the second and third, tracking this up, and then you can feel it right there. So same thing on this side, have them flex, and then yep, you can feel it right there.
Pulses are grade 2+.
All right, and that then we need to do the tibial edema
And skin.
and skin temp. So you're going to, here's the backs of your hands. So feeling here, and then pressing for tibial edema here.
Skin is warm, no tibial edema bilaterally.
Okay, and then we're going to inspect the toes, and then do our cap refill. And then same thing for upper extremities. So inspecting, and then doing our cap refill.
No peripheral cyanosis or clubbing. Cap refill is under 2 seconds bilaterally.
Yep. And that is it.